So we get to talk about Staphylococcus aureus. Now, the Staphylococcus aureus, yes, Staphylococcus as a whole is like a group of bacteria, right? But the Staphylococcus aureus is like amongst this group is like the most popular. Do you understand? So most of the times when anybody tell you about Staphylococcus, the first one that they usually mention is Staphylococcus aureus. Staphylococcus aureus, Staphylococcus aureus. Okay, so let's quickly look at its microbiology. Look at its microbiology. So for Staphylococcus aureus, you say that what? It's a gram positive. It's a round shaped bacterium. Okay, and it's a member of the what? Firmicutes, and it's frequently found in the nose, in the respiratory tract, and on the skin. That means these Staphylococcus aureus they can be normally found in your body. Do you understand? They not really cause a problem, but sometimes like probably if they are found in a location where they are not supposed to be there, or if your immune system is not up to standard, that's when they start causing infections to you. Right? So for their domain, they're actually bacteria. For their phylum, they are what? Bacillota. For their class, they are bacilli. For order, they are what? Bacillales. For family, it was Staphylococci. Genus is Staphylococcus. Then for species, is now talking about Staphylococcus aureus. Okay. So for characteristics, they are gram positive. That means what? They will retain a crystal violet when you do that gram staining procedure. They're coagulase positive. They produce the enzyme coagulase, which clots plasma. They are facultative anaerobes. That means they can grow even when there is oxygen or there's no oxygen. There's no problem for them, right? Then they produce the enzyme catalase, and the enzyme catalase is an enzyme that breaks down hydrogen peroxide, sorry. Okay. Pathogenicity, right? So it's a versatile pathogen which can cause what? A wide range of infections to you. Skin infections can cause things like boils, impetigo, cellulitis, abscess, right? Can also cause respiratory infections, systemic infections, bacteremia, where you're having bacteria in your blood. Then toxin mediated disease like what? Scalded skin syndrome, food poisoning, toxic shock syndrome, all of that. Okay, so for their virulence factor now, like what are the things they actually possess that makes them to be able to be this deadly, right? So protein A, we have already spoken. We have had what a special lecture on what the virulence factors of Staphylococcus aureus. So if you need that one, you drop it for me. You just drop a comment and I'll drop you the link, right? So toxins, enzymes, they all possess that. So they could be resistant to methicillin too. Okay, that's when they are resistant to methicillin and other beta lactam antibiotics, right? So if they are resistant to methicillin and other beta lactams, you might want to what? Now introduce other types of antibiotics like what? Vancomycin, linezolid, daptomycin, and the rest, right? So diagnosis and treatment is culture and sensitivity tests, gram staining, coagulase tests, right? Treatments depending on the type and severity of infection, but you might want to use other types of antibiotics that they are not resistant to, or you might want to do some combination therapy and all of that. But we'll talk about in-depth treatment of these things, of these staphylococcus infections on a different lecture, right? So that's it for Staphylococcus aureus, classification, characteristics, diseases they cause, virulence factors, and all of that.